Hello there and welcome to part 3 talking about bunions. I'm the Fly Foot Doctor, foot and ankle surgeon practicing out here in Houston, Texas. It's the Fly Foot Doctor on Instagram, TikTok, as well as on YouTube. Follow me for more bunion videos and don't forget to watch the rest of the series about bunions. I've answered a lot of the questions and I'm just kind of answering most of the questions that patients have posed to me so I can hopefully give you some clarifications on and about bunions. So in this video, I'm going to be talking about some more questions. I'm answering some more questions. One of the questions is, can bunions come back after surgery? Are there any home remedies for bunions? Can bunions be treated without surgery? Can bunions cause other foot problems? And what are the best shoes for bunions? Now, some of these questions I have sort of touched on in the other video, so be sure to go back again to the playlist and watch the other videos. But this one here, I'm going to be able to answer some of them, so stick with me and let's go. So, can bunions come back after surgery? And that is an excellent question. I'm glad you asked. So for those of you that may be wondering, the answer is yes and no. So just like most things, there are no absolutes in life. If your bunion is not fixed appropriately, it could come back. If the inappropriate procedure is performed for your bunion, it could come back. If there has not been a proper evaluation of your bunion so that the root cause of the bunion is addressed, it could come back. So, can it come back? Yes, it does depend on a couple of factors. So if it's fixed, a lot of, some surgeons may give you that, guarantee that it's never going to come back. And some will say, you know what, because of your lifestyle or your work or your inability to stay off your foot for an extended period of time that will require a bit more of an invasive procedure, perhaps we may have to do this other procedure, which may have the bunion come back. So this is a discussion that you're going to have with your surgeon to have further clarification. Let me give you an example. In a very, very bad bunion with a large intermetatarsal angle, as we call it, may require a fusion back here at the joint. That fusion may require you to be off of your foot for about 4 weeks. And let's say you are a young mom of 3 and you have, maybe a toddler around. You can't stay off of your feet for 4 weeks because you have no help. You stay at home with all 3 kids and you're super busy. But you just don't like this bunion. It hurts you when you walk around and it's just causing a lot of pain. Your surgeon will likely tell you you need the more invasive procedure. You need the procedure that makes you stay off your feet for an extended period of time. But because of your job requirement at home, as a stay-at-home mom with babies, with your hands full, you can't stay. But because you want some relief, at least from that bump and that inflamed bursa, he gives you another option. It says, okay, there's something else we could do, but you do know this is not taking care of the root cause, which is back here that would require more, again, of an invasive and involved procedure. And you opt to go for the less invasive, less aggressive procedure. Well, you are going to have pain relief. You are going to be without pain maybe for 10 years, maybe even 15 or 20 years. And that may be just good for you. That's great. You are fine with it and you don't have any problems. Besides, perhaps you're a 35-year-old mom now. This didn't start to bother you till 5 years ago, but you've had that bunion since you were 15. So for 20 years or even 30 years, it didn't bother you. But now it's starting to bother you over the past 5 years. Assuming our mathematics is, based off of the past, you have at least another 15, 20, 30 years before it starts to bother you again. Theoretically. Again, nothing's written in stone or guaranteed. You may take that chance and say, you know what, at that point, if I need to, I'll do the more invasive procedures. My kids will be grown and out of the house, and I will not need to be as involved in their lives. So I can't afford to take time off and stay off my foot for 4 weeks. So in that situation, you know that the bunion may come back. So again, it just depends on the procedure that's chosen, how the evaluation is made, other requirements that you have or the surgeon has. So the answer, short answer, yes, it can come back, but it depends on other things. I love this question because it's really a good point of discussion where we break down to the patient so they really understand what it is that we're talking about. All right, let's get to the next question. So the next question that I'm going to be answering, and I'm going to bunch both of them together, is, or are there any home remedies for bunions? And can bunions be treated without surgery? So I kind of talked about these a little bit before, where are there home remedies? So in a remedy, I will suggest, or I will guess that you were talking about getting rid of the pain, not fixing it or getting it back to straight rectus, because like we said, you are not going to get it back to rectus or straight without surgery. But you can cushion your foot with some bunion sleeves and bunion paddings. Those really help. You can also have those little spacers that push your toe back straight. Those will help as well. Now, if you're inflamed or having pain, of course, you can use anti-inflammatory medications from over the counter, and those really help as well to get rid of the pain. We talked about orthotics, custom made. Find a podiatrist in your area that can custom make the orthotics to fit you, okay? So those are the ways that you may be able to take care of it. As far as home remedies, again, over the counter and anti-inflammatories, making sure that you wear shoes that have a wide toe box so it's not pushing on that bunion and causing pain and discomfort, okay? If you're at home, try not to walk barefoot. Wear supportive house shoes that could also help. So these are ways that you may be able to take care of your bunion. All right. So the next question I'm going to be answering is, can bunions cause other foot problems? And the answer is yes. The reason is because you're supposed to be nice and straight like this, okay? And sometimes in a bunion, you're starting to have this big toe push over on this side. When you have the big toe pushing on that side like that, what's happening now, it's pushing on the second toe. And what it then happens is it pushes this so much and goes under that second toe. When it goes under the second toe, that second toe starts to rise up, and the plantar plate, which is a band of tissue under that second toe, could become weak and get pushed up, causing a hammer toe. Because that second toe still wants to touch the base of the floor, it starts to bend and bend. Now you have a corn here, you have the bunion that's overriding like this, and the second toe is dislocated and come over like that. So yes, absolutely, bunions can cause other problems. And when they cause other problems like that, this is what we get. We could get hammer toes, we could get plantar plate disruption or dislocation of the second toe. We could cause pain in the foot and stuff like that. And that is an issue and really, really could complicate stuff. That's why, again, if your foot is not hurting, but you see that your foot is starting to change because your bunion is getting worse, you may get a consultation because you want to make sure that you're fixing it so that the other foot problems does not get worse. Okay, so the question I'm going to answer here is, what are the best shoes for bunions? So there are lots of shoe brands out there, and in some of my other videos I talk about how to pick a shoe and what to look for when you're picking a shoe. So you want to make sure that, again, if you have bunions, you want to wear a shoe that has a wide toe box. What does a wide toe box mean? It means the area where that you are putting your foot and your toes in are wide enough to allow for range of motion. Nothing is compressing. You have nice mesh so that your foot can expand and allows to accommodate that bunion. If you're wearing high-heeled shoes with the triangular shaped toe box, if you're wearing it to dinner, a party, just for a couple hours, look, I'm a fashionista, at least I like to think so. So I understand you still want to wear your pretty shoes. That's okay, in my opinion, because you're not wearing it continuously. Now, if you were wearing it for 8 hours a day, 5 days a week, that is not okay. If you're wearing it for 2-3 hours once a week or twice a week, come on. It's hard to tell someone who loves to wear their shoes not to. But just be sure, as soon as you sit down, take your feet off. Take your feet out of those shoes. As soon as you can, take your feet out of those shoes because you don't want to continually compress them. I like brands like Asics, Hoka, New Balance, Brooks. Those are good brands that I have as well, and they really work for me. Again, you want to wear a shoe that has an extra width, not a tight shoe, because that is just going to cause problems. If you want me to look at your shoe and kind of evaluate and see if it works, especially for bunions, let me know. Leave a comment down below and we'll go over it. So we've come to the end of this series, part 3, talking about bunions. Again, don't forget to check out the other videos about where I answered questions about bunions. And if there's a question that you have that I haven't answered, leave it down below. I'll be sure to get to it. Follow me on my other platforms on Instagram, YouTube, and on TikTok. It's The Fly Foot Doctor. If you want to see me personally for a consultation, check the link down below. Book an appointment online or give us a call and we'll be able to book an appointment for you. If you like this video and you found it beneficial, please subscribe to our channel. We'll really appreciate it. Hit the like button and also share this video with the rest of your peers, friends, and family. Till next time, it's The Fly Foot Doctor. Peace out.